Hi there, Dr. Sadaf Qureshi here, and today we are going to talk about dural venous sinuses. If we look at the brain has different protective mechanisms for itself, like cranial cavity bones, CSF or cerebrospinal fluid, and meninges. Talking about meninges are system of membranes that protect the central nervous system. They include dura mater, arachnoid matter, and pia mater. Dura mater in cranial cavity has two layers, periosteal layer and meningeal layer. Most of the area in the skull, periosteal layer and meningeal layer, are tightly attached with each other and do not have the area or space between them. But in some areas along some lines, the periosteal layer and meningeal layer are separated from each other, and there is fluid in between these layers, and that area is called as dural venous sinuses. Talking about dural venous sinuses, what are they? The dural venous sinuses are a network of venous channels located within the cranial cavity that is sandwiched between the two layers of dura mater. There are the periosteal layer and meningeal layer. And these sinuses are responsible for draining venous blood from the brain and cerebrospinal fluid into the internal jugular vein. Talking about the types of dural venous sinuses, they may be paired or unpaired. The paired dural venous sinuses include transverse sinus, sigmoid sinus, superior petrosal sinus, inferior petrosal sinus, and cavernous sinus. While unpaired dural venous sinus include superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, and intracavernous sinus. Now we'll talk about all of these sinuses one by one and where they are located and what area of brain they drain. Let's talk about these sinuses one by one. The first sinus we have is superior sagittal sinus. The superior sagittal sinus lies the upper fixed border of phalanx cerebri. It runs backward and becomes continuous with the right transverse sinus. The sinus communicate on each side with the venous lacunae, and various arachnoid villi and granulation project in this lacunae. The superior sagittal sinus receive the blood from superior cerebral veins, and they drain that area of cerebrum. The next sinus we are going to talk about is inferior sagittal sinus. The inferior sagittal sinus lies in the free lower margin of phalanx cerebri. It runs backward and joins the great cerebral vein to form the straight sinus. It receives cerebral veins from the medial surface of cerebral hemisphere, and that's the reason they drain the medial surface of cerebral hemisphere. Then the next sinus we have is straight sinus. The straight sinus lies at the junction of phalanx cerebri with tentorium cerebri. It is formed by union of inferior sagittal sinus with great cerebral vein, and it drains into the left transverse sinus. Next sinus we have is right transverse sinus. The right transverse sinus begins as a continuation of superior sagittal sinus. It lies in the lateral attached margin of tentorium cerebelli, and it ends on the side by becoming the sigmoid sinus. Next sinus we are going to talk about is left transverse sinus. Left transverse sinus is usually a continuation of straight sinus, and it lies in the lateral attached margin of tentorium cerebelli, and it ends on the side by becoming the sigmoid sinus. The next sinus we are going to talk about is sigmoid sinus. It is a direct continuation of transverse sinus. Both right transverse sinus and left transverse sinus form the sigmoid sinus. Each sinus runs downward behind the mastoid antrum of temporal bone. It then leaves the skull through the jugular foramen to become the internal jugular vein. The next sinus we have is cavernous sinus. Each cavernous sinus lies on the lateral side of the body of sphenoid bone. Anteriorly, the sinus receives the inferior ophthalmic vein and the central nerve vein of retina. Then sinus drains posteriorly into the transverse sinus through the superior petrosal sinus. There is another sinus, that is intracavernous sinus, that connect the two cavernous sinus through the sella turcica. Then we have another sinus, that is sphenoparietal venous sinus, that lies below the lesser wing of sphenoid bone. It drains in cavernous sinus. And the next sinus we have is superior petrosal sinus, that starts from cavernous sinus and it drains into the sigmoid sinus. It connects cavernous sinus with the sigmoid sinus, and it lies above the inferior petrosal sinus. Then we have inferior petrosal sinus, that starts from the cavernous sinus and drains into the sigmoid sinus. It connects cavernous sinus with the sigmoid sinus, and it lies below superior sagittal sinus. Next sinus we have is occipital sinus. The occipital sinus line sinus lies in the attached margin of pallex cerebelli. It communicates with the vertebral veins through the foramen magnum. It is connected to the confluence of transverse sinus. Then we have internal jugular vein, that is direct continuation of sigmoid sinus and is the final drainage of dural venous sinus of brain. It eventually drains into the jugular vein and consequently to the heart. So this was all about dural venous sinuses. We talked about all the dural venous sinuses one by one and where they drain and from what area of the cerebrum they drain. So thank you for watching. Don't forget to like, share, subscribe and comment.